Hello, uh, and I'm really sorry to go live in this time actually. So, let me discuss about the prenatal vitamin. Okay, and if you do have any queries, you can ask me later. Let me share few things and few knowledge about uh, uh, folic acid. Okay, so am I audible first of all? Am I audible? Yes. Am I audible? Is the video visible? Am I audible? I just wanted to check. Am I audible? Am I audible? Okay, fine. So I just wanted to share a few things about folic acid. So then I'll tell you about this brand and all. Okay, and before that, so this is Asha here. So I'm going to discuss about folic acid and why folic acid is very important when you are trying to conceive and also during early pregnancy. Okay. So the first thing for neural tube development. Okay. What exactly is neural tube development? So like the neural tube eventually forms the baby's brain. Okay, baby's brain and cord. Okay, spinal cord. Okay, so if you take adequate folic acid, like when you're planning for pregnancy and during early pregnancy, it helps to prevent neural tube defects. Okay, such as spina bifida. Okay, so like that. Okay, spinal cord issues, neural tube defects. Okay, so like that, we can avoid it. Okay, and like it it helps to prevent birth defects. Okay, for example, heart defects. Okay, cleft lips. So like that also it can be prevented. Okay, so early pregnancy support, folic acid is basically helps with uh, like you know early pregnancy support. Okay, so in your early weeks of pregnancy, either this iron or folic acid is mandatory. It is completely recommended for women who are trying to conceive to start taking folic acid supplements before conception. Okay, so so that we can easily identify. Okay, that is very important. Okay, and if you are taking adequate amounts, so I am keep on mentioning that adequate amount. What is exactly adequate amount, ma'am? 400 mg, up to 400 mg you can take it a day. Okay, so it is usually recommended to take start folic acid at least like 3 to 4 months before when you are planning for pregnancy. Okay, at least 3 months before. So and and you can continue up to 12th weeks of pregnancy. Okay, 12 weeks of pregnancy you can take it. Okay, So, when you are trying to conceive, folic acid is mandatory. Adequate folic acid is very, very important, so that you can avoid a risk of certain, pregnancy complications, as well as, birth defects also, to prevent birth defects. Okay. Sometimes, if you are adding folic acid regularly, you can avoid, sometimes preeclampsia, preterm birth also can be avoided. Okay. So, like you know ma'am, so I am not interested to take tablets, what should I take? If you ask me, there are natural forms of folic acid is completely beneficial. You can take, okay, dark leafy green vegetables, citrus fruits, beans. Okay. So like that you can add, there are many folic acid foods are available, folate foods are available, you can take it. Okay. So better you can go for dark leafy green vegetables, that is very, very good. Okay. So let me discuss about this tablet. So this one is Feronia XT, which have, iron plus folic acid. Okay. So this iron plus folic acid tablet, okay, if you check it out, so look at the folic acid mg, 1.5 mg. So why, uh, uh, like you know iron plus folic acid recommended? Sometimes due to, hemoglobin, or blood issues, or anemic. If you're anemic, you can take both folic acid plus iron. Okay. Or else you can take folate 5 mg, you can take it. Okay. So it helps a lot. Okay. So you can, always consult with your healthcare provider. Okay. Or else you can take these tablets. Give me a second. So I was having very noise disturbance. Okay. So yes. Okay. So folic acid is very, very important when you are trying to conceive. It helps to avoid neural tube, okay, uh, defects. Okay. Such as spina bifida, or else, like you know it helps to avoid spinal cord issues or baby brain issues. Okay. And it helps to prevent birth defects such as congenital abnormalities. Okay. Heart defects or cleft lips. Okay. So like that can be avoided. And during early pregnancy it also helps a lot. Okay. Yes. Hope it is clear right now. Okay. So you can take up to, throughout pregnancy it is recommended, but up to 12 weeks it is completely mandatory. Okay. Am I audible? Hope whether it is clear and audible. Okay, fine. Yeah. So try to take folic acid. Okay. And if you are not interested to take any medicine, you can take leafy green citrus fruits. Okay. Beans, or like uh, okay, dark leafy greens. So like that you can add it. There are many folic acid and folate rich foods are available. Okay. So I've mentioned in many posts. Okay. And if you are taking supplementation, always consult with your doctor, that is also very important. Okay. Okay. So that's it. Do you have any doubts? Do you have any doubts? If you do have, please let me know. One particular food will not help with AMH level. So you need to continue different types of lifestyle changes based on your AMH level. Okay, so you need to share your folic acid AMH level, and you need to submit your vitamin D level, B12 level. Okay, then only we can help. But generally for AMH level, okay, so you can add vitamin D rich foods. Okay, so that helps a lot. I do have different prenatal vitamins. Okay, I'll update you one by one. Okay, so maybe tomorrow or day by day, no, I'll tell you. So not everything we can discuss here. So yes, any other queries? Okay. Any other queries? So, I've discussed about the preconception supplementation, why it is important. So, yeah. So, usually I recommend consuming foods rich in folate, but always natural forms of food is very, very needed and it is encouraged. Okay, so that is very important. When you're taking folic acid or any supplements, okay, do not stop after pregnancy. So you need to complete those medications up to first trimester. That is also very important. Okay, so folic acid plus iron supplement when you're planning for pregnancy to avoid birth defects. Yeah. See, why folic acid? So you can ask me, if you ask why folic acid is important, ma'am. Many neural tube defects, okay, occur only in the first few weeks of gestation. Okay, so that's why we suggest folic acid when you're trying to conceive. Okay, how it reduces the birth defects. Okay, especially the folic acid. Okay, has been associated with the lower risks of any other abnormalities heart defects, cleft lips, as I mentioned before. But but it mainly concentrate on the neural tube defects, because sometimes these tube defects can happen often before a woman is aware that she is pregnant. Okay, so that's why we are recommending before that. Okay, and yes, what are the dietary sources, like what are the natural sources of folic acid? Of course, leafy greens, citrus fruits, beans. Okay, even papaya is rich in folate. Okay, but still people think that papaya is not good when you're trying to conceive. That is completely not true. You can add, okay, and unripe papaya or unripe pineapple is not recommended when you're trying to conceive or even during pregnancy. But ripe papaya you can add it. Okay, yeah. Hope it is clear right now. Yeah. Any other queries? Well, it helps with implantation. Of course, yes. See, the fertilized egg rapidly divides and forms the embryo. Okay. So, sufficient folic acid supports this crucial process. Okay. And it makes sure that the development of the baby, is healthy. Okay. So, that's why. Can we take ripe papaya daily? Of course, yes, you can. Make sure it is make sure it is not half ripe or unripe. That is very important. Okay. So how long can we continue? You can start folic acid at least 3 months before when you are trying to conceive. Okay, and up to 12 weeks of pregnancy you can continue the folic acid. And why this Feronia XT, ma'am? Okay, so this Feronia XT, it is helps to maintain the levels of iron also. Okay, and iron and folic acid during pregnancy. Okay, so if you are pregnant or planning for pregnancy, it is completely safe to take this Feronia. Okay. Yeah, hope it is clear right now. Okay, so we'll discuss few other things regularly. Okay, tomorrow or day after tomorrow I'll tell you another prenatal vitamin, or what other prenatal vitamins is needed when you are trying to conceive. Yeah, take care. Bye bye.